Hi, I'm Erin Coyle.
I'm Alexis Petito.
Faith Bernhardt.
Sierra Brown.
And welcome to our Radio Lab.
So it was the summer of 1971. James Weston, a New York Times columnist, was covering a ping pong tournament in Beijing when all of a sudden he felt a pain in his lower abdomen. In no time, he was being rushed to a hospital in China to have emergency appendectomy. There, they used a method called acupuncture anesthesia. Now, at this time, this was unheard of in the United States. When Weston was out of surgery, they also used acupuncture as a sort of painkiller, if you will. When he eventually came back to the U.S., he wrote about his experience in the New York Times and exposed countless Americans to acupuncture therapy for the very first time. And this is what started Western science and acupuncture being combined into.
Alternative medicine is a term for medical products and practices that are not part of the standard care given by medical doctors.
There are many different types of alternative medicine whose expenses are covered differently or not at all, depending on where you live in the world.
Today we will talk about the four most popular alternative medicines, which are homeopathy,
Energy therapy.
Acupuncture.
Medical cannabis.
Homeopathy is a medical practice based on the idea that the body has the ability to heal itself. It was founded in the late 1700s in Germany and has been widely practiced throughout Europe and Asia. Homeopathy is based on the idea that like cures like. If a substance causes a symptom in a healthy person, giving the person a very small amount of the same substance may cure the illness. In theory, a homeopathic dose enhances the body's normal healing and self-regulatory processes.
Energy therapy is all about self-healing. It's not just relieving the pain for the moment, but soothing the overall well-being of the person by rebalancing the energy fields within that person.
Typically found in traditional Chinese medicine, acupuncture has become a very rapidly growing practice in the United States in recent years. Acupuncture uses fine needles in specific points of your body for therapeutic purposes. It's based on the ideology that all living things have an inner energy called qi, and this flow of energy is vital for optimal health.
According to the NIDA, medical marijuana refers to using the whole unprocessed marijuana plant or its basic extracts to treat a disease or symptom. Some of these conditions include multiple sclerosis, severe muscle spasms, cancer, epilepsy, glaucoma, Crohn's disease, AIDS, Tourette's syndrome, ALS, and anorexia.
Many different types of standard medicine is covered by different types of insurance, although when you are talking about different types of alternative medicine, many insurance companies do not cover it. Different types of alternative medicines have different types of coverage based on the insurance you have, the visit, the medicine, and the therapy you need. In the case of homeopathy, many different types of insurance cover the care due to professional homeopaths being licensed professionals such as medical doctors and chiropractors in their practice. Although when a homeopath is not a licensed professional, it is unlikely that an insurance company will cover his or her care, except for the instances when a medical doctor prescribes homeopathic care and the insurance company agrees to pay for specialty care when it's prescribed. When receiving homeopathic care, the first interview usually lasts 60 to 90 minutes. Therefore, homeopaths commonly charge more than usual on the first visit. Some insurance companies only pay for the first visit and none of the visits after it. So, the patient may be required to pay a portion of the homeopath's fee. Also, insurance companies will not cover the small expenses of homeopathic medicines because they tend to be paid for by prescription drugs only, or other homeopathic remedies are primarily over-the-counter drugs.
In 1993, the Federal Acupuncture Coverage Act was introduced into Congress. It was supposed to add acupuncture as a benefit covered by both Medicare Part B and the Federal Employees Health Benefits Program. Congressional support of this bill slowly increased with the heightened public interest, but it was yet again turned down in 2011. Despite the government's lack of coverage, many private insurances cover acupuncture treatments up to a certain extent. Even though acupuncture isn't covered by government insurances, it's still regarded like all other government-sanctioned medical practices. Most acupuncturists are not physicians, but they are still licensed. The National Certification Commission for Acupuncture and Oriental Medicine has developed different certification criteria and requires certain kind of examination for acupuncturists to become licensed. The growth of this practice is leading to more and more physicians wanting to become licensed in acupuncture therapy. The increasing interest in this field seems to be a challenge for Western medicine. Most doctors do not know how to incorporate this into their current field, and they do not think acupuncture has merited the opportunity yet.
In the field of energy therapy, the likelihood of having a claim is rare due to the non-invasive nature of energy therapy and the fact that energy therapists do not medically diagnose or prescribe medication to their clients. Because of this, the annual cost of coverage for liability insurance is quite low, starting at $150 for students and $140 for practitioners.
Although medical cannabis is legal in 31 states, the doctor's visit required to obtain the license and the actual cannabis plant and byproduct are not covered by private or government insurance.
Many different types of alternative medicine are used around the world in different countries where there are different types of government coverage or private insurance companies that pay for the patient's medicine. In the case of homeopathy, there are many different health insurance companies that cover it in Canada. Canada has its own different types of government coverage, such as Alberta Blue Cross, Claim Secure, and Green Shield. These types of insurance companies are used for supplement health coverage and extend their health coverage into homeopathy. Different types of alternative medicines have different types of regulations in different countries. For homeopathy, regulations in Europe vary depending on the country. In Austria and Germany, there's no specific regulation, while in France and Denmark, you need a mandated license to diagnose any illness or dispense any type of product whose purpose is to treat illness. Some homeopathic treatments are covered by the national insurance of several European countries, including France, some parts of the United Kingdom, and Denmark. In other countries, such as Belgium and the Czech Republic, homeopathy is not covered. Although in Austria, public insurance requires scientific proof of effectiveness in order to reimburse medical treatments, but exceptions are made for homeopathy. In 2004, Germany, which formerly offered homeopathy under its public health insurance scheme, withdrew this privilege with few exceptions. In 2005, in June, the Swiss government, after a 5-year trial, withdrew insurance coverage for homeopathy and 4 other alternative treatments, stating that they did not meet efficiency and cost-effectiveness criteria. In Mexico, homeopathy is currently integrated into its national healthcare system. In 1895, a presidential decree from Gao Porfirio Diaz established the first homeopathic school and hospital, as well as regulated specifying training requirements for homeopathic doctors and hospital, as well as regulations specifying training requirements for homeopathic doctors. India has the largest homeopathic infrastructure in the world, with low estimates at about 64,000, but going as high as 300,000 practicing homeopaths. In addition, there are 180 colleges teaching courses and 17,500 government clinics with 307 hospitals which dispense homeopathic remedies. In China and Japan, homeopathy appears to be almost unknown.
Cannabis research has been held back worldwide because the status of marijuana is typically illegal. But that has changed in Canada. Canada currently has a booming cannabis market, and the Canadian government now finances medical research. Canada allows patients to buy medical cannabis with money from healthcare spending accounts, which are financed by employers. Some insurers in Canada are starting to cover medical cannabis because of rising demand. Green Shield Canada, a not-for-profit benefit carrier, started to cover medical cannabis for certain conditions.
Although certain alternative medicine methods like homeopathy are covered by health insurance, some methods like energy therapy and acupuncture are not universally covered unless deemed medically necessary.
Some benefits of energy therapy are It creates deep relaxation and aids the body to release stress and tension. It helps relieve pain, assists the body in cleansing itself from toxins, supports the immune system, and helps spiritual growth and emotional clearing.
Although most people associate acupuncture with risks, acupuncture has actually become safer and more sterile in recent years. Thin, flexible needles made of stainless steel are used to smoothly slide into the skin. The FDA regulates these needles as medical devices that are labeled for one use only. This helps with the sterility of the practice and lowers the risk of any complications. The possible risks vary depending on different health conditions and circumstances. Bleeding, bruising, and soreness commonly occur at the insertion site. Unsterilized needles could infect the patient, and rarely a needle might break off and damage an internal organ. Patients who are pregnant or have a bleeding disorder are advised against using acupuncture therapy to avoid any serious injuries. A 2001 study found that in more than 34,000 acupuncture treatments, no serious adverse events were reported in correlation to acupuncture therapy. Minor events such as nausea or fainting were reported between 0 and 1.1 people per 10,000 treatments. Aside from the insertion site bruising, more serious side effects such as decrease in blood pressure have been reported. In undeveloped parts of the world, insertion site infections are more common due to the multiple uses of needles. Most patients describe their experience as relaxing and calming. Along with these minimal risks are great benefits. When acupuncture is performed correctly, it is very safe. There are little to no side effects, which allows it to be combined with other treatments. Acupuncture also provides an alternative way to manage pain in patients where medications are not suitable. In 2003, a review of clinical trials identified that acupuncture proves to heal 28 different diseases and/or conditions. As the Chinese people continue using acupuncture as their primary healing method for most ailments, physicians in the United States use acupuncture as an adjuvant therapy. Patients and physicians associate the use of acupuncture with treating acute and chronic pain. Indications for use of acupuncture range across different systems, from musculoskeletal, neurological, endocrine, psychiatric, gynecological, gastrointestinal, and addiction to less common reasons like respiratory issues, sleep deprivation, hypertension, and allergies. As the acceptance of acupuncture grows, so does the scope of ailments treated by acupuncture.
Although many homeopathic treatments are considered very safe, some remedies have been known to cause abdominal pain, headaches, nausea, rashes, and pancreas or liver damage.
Cannabis is typically regarded as having no symptoms, although those who are genetically susceptible to developing schizophrenia are advised not to use medical cannabis because it may cause them to develop schizophrenia. Some benefits of medical cannabis are the reduction of ocular swelling seen in patients with glaucoma, the stimulation of appetite, which helps AIDS and cancer patients, and the anti-inflammatory properties of the cannabis plant can help sufferers of Crohn's disease.
The benefits of homeopathy is that it's a safe and effective remedy for treating facial pigmentation.
Although there are many benefits to energy therapy, there are some disadvantages as well. For energy therapy, there is limited scientific support, limited health insurance coverage, and the individual experience varies, meaning one practice may work better than others based on the individual experience.
Some fun facts about alternative medicine are: homeopathy is the second largest system of medicine in the world, and over 200 million people use it worldwide. In India, more than 100 million people depend solely on homeopathy for their health care. Another fun fact is that Prince Charles is a user of homeopathy and has spoken out in favor for it to be integrated into the healthcare systems. The Queen is a patron of the Royal London Hospital for Integrative Medicine, which was formerly the London Homeopathic Hospital. Many sports personalities and celebrities are among the users of homeopathy, including Paul McCartney, David Beckham, Tina Turner, Jude Law, and Jennifer Aniston.
Fun fact, acupuncture needles were first made out of stones, bamboo, fish bones, bronze, gold, and silver, which were refined into thin needles.
There has been many amazing stories about alternative medicine.
In 2004, Charlotte Figge was born. By the time she was 3 months old, she started having severe seizures. Doctors said she would grow out of it, but she hadn't. She was soon diagnosed with Dravet syndrome. Charlotte's parents were once strong advocates against the use of medical marijuana, but they were desperate to help their child. Now, Her parents found a low THC, high CBD strain of cannabis that would soon help control her disorder. They chose this strain because THC causes psychoactive effects and CBD is found to help reduce seizures. Now, there is a strain named Charlotte's Web that helps hundreds of epilepsy patients and those whose conditions cause them to suffer from seizures.
So overall, do you guys believe in alternative medicine?
Like, on my part, like, I don't know if it works because, I mean, I've never experienced it. And like Alexis was saying, like, most people think it's more of a placebo effect. Like, you think you're getting better, but are you really?
Like, it really depends on the type, because my type, like, people are skeptic about it because of the placebo effect, because you dilute it so much and there's really, like, none of the actual medicine left. So in homeopathy, you just put, like, a bunch of water and then just a little bit of the actual substance. So, like, when people test, like, the actual, like, medicine, there's, like, sometimes there's no traces of the actual medicine in, like, the pill or, like, the drink, like, or whatever type of medicine you get with it.
Yeah.
So that's why, like, sometimes, like, you could see, like, it works, but also it could be the placebo effect.
Yeah, with energy therapy, it's all about self-healing, using the energy within. Like, I'm not really sure if that necessarily works because there's no medication.
Like, there's no, like, evidence.
There's no
It's just based on a
scientific
feeling.
proof. It's just everyone's personal experience. But
See, like, that's how acupuncture is as well. Like, they use your chi, your inner energy, to heal yourself. It's like, if you can hit these certain pressure points, your energy will be released. But most scientists attribute that to where, like, the muscles and tissue connect, and it's like your neurological response, and it just releases, like, endorphins, and it's more of like an adrenaline thing than an energy thing.
So, like, acupuncture is basically a mix of, like, medicine and then, like, also, like, chi. Like, so it's, like, energy therapy mixed with, like, standard.
Like, the ideology is that it's your energy can, like, help you restore your health, but Western scientists can't really prove that, and they attribute it to, like, your neurological symptoms and stuff.
On my topic of medical cannabis, I do believe in it because there are chemical components in the plant, and there have been studies that have shown that it does help patients,
That's like a
seizure
more
patients.
accepted
Yes,
too.
yeah, I can accept medical marijuana because it is a chemical substance. It's not just like this energy.
It's like actual evidence, like, you
yeah,
can prove
you
it.
can see it.
Like, acupuncture, you can say, like, it's real due to, like, the muscles and, like,
Yeah.
the nerves. Like, you can see that. It's not like with, like, energy therapy, it's like you can believe, like, that's like believing in anything basically. So
Yeah.
that's, like,
Yeah.
it's just not there.
it's more like
It's not
spiritual.
physical.
Yeah, it's spiritual healing. And I guess homeopathy is like, you can either, like, oh, it's the placebo, or it's like, oh, I actually, like, feel this way. So I don't know. But thanks for listening to our radio lab.
It's been great.
everyone.